Welcome to the See the Signs Vision Training webinar. See the Signs is a digital tool to help GP practices identify, manage and safety net patients at risk of cancer. To launch See the Signs on your computer, you need to go to your desktop and double click on the See the Signs app shortcut, which will look like a small blue and white C. That will then launch the See the Signs toolbar, like so. The See the Signs toolbar has 3 buttons and I'll go through each one in turn. The first is Risk Assess the Patient, and this gives you access to our clinical decision support tool, referral forms and patient information leaflets. The middle button is the Practice Dashboard button, and this is our safety netting tool. The last button is an account button. It also lets you shrink this toolbar, and you can also move the toolbar around your screen to wherever is most comfortable. This is a test version of Vision with a test patient, so there's no need to worry that you're seeing anything you shouldn't today. Now we're going to use our test patient, Mr. James Bond, a 64-year-old patient, to run a scenario. So let's say we're seeing this patient in clinic and we're worried that he has cancer. But either you may not be sure what cancer type he has, or if you do have an idea, you may not be sure whether to do a test, investigation or referral, or a combination of the 3. And that's when this first button, Risk Assess the Patient, comes in handy. The first time you ever click on one of these 2 buttons, you'll be asked to register as a user of See the Signs. This is important for 3 reasons. Firstly, we sync up your Vision login details with See the Signs, so in future, See the Signs will automatically recognise that it's you and log you in. Secondly, we need to know what practice you're in because of this Practice Dashboard safety netting function. Lastly, we need to know what CCG you're in because we configure the tool to what direct access is available in your area. When you click on this risk assessment button, you'll be brought to the risk assessment homepage. In the top left, you'll see your CCG, and underneath this in the blue bar, you'll see the patient that you have opened. If you have accidentally opened the wrong patient, you'll need to close See the Signs, go back into EMIS, get the correct patient open, and relaunch See the Signs using that risk assessment button. Underneath the patient information on the left is a notice board, and if there are any changes to national or local cancer guidelines or to See the Signs, they'll get placed in the notice board. Then next to this you can see there are 2 buttons, System and Search, and this allows you to risk assess your patient. The System button allows you to risk assess via a system like chest, gynae, skin, etc. Or you can search by something specific, and that could be a risk factor, a symptom, a sign, or an investigation result. So let's say we're searching for something specific. We'd click on the search button and then you'll be brought to the search screen. You can then either click on the letter your word begins with. So if I was looking for weight loss, I'd click on W and select weight loss. Or you can type in what you're looking for. So that could be thrombocytosis, anemia, and you can select that here. If we go back to the home page, if you remember, you can also search by system. So here you can see icons related to the NICE NG12 2-week weight pathways. There's no gynae or childhood cancers here because this is a 64-year-old male, but if you did have a woman or a child, you would see those options. You can then select one or multiple systems to search within. Regardless of whether you're searching in a system like chest or using something specific like weight loss, you will always be shown risk factors, symptoms, signs and investigation results related to that system or symptom based on NICE and local cancer guidelines. The age and the gender of the patient is pulled through from EMIS, and then you need to go through and select what is positive for your patient. If something is left blank, it will be read as negative. We are on the chest system, so in risk factors you can see things like asbestos exposure, past smoking, etc. So let's say we have a past smoker. If we then go to symptoms, you can see a variety of chest symptoms and more vague symptoms, and this is reflective of what is in the chest cancer guidelines. Let's say our patient has some fatigue, some shortness of breath, and some weight loss. If you change your mind, you can just untick and it will go back to blank. Let's say the examination is normal, but if you had found anything on examination, you can tick it off here. And let's say we haven't done any investigations yet, and we click on Risk Assess the Patient. This will then bring you to our recommendations and considerations page. If you are in an area where you refer between two different hospitals that have two different referral guidelines, then you will see the options here that you can switch between. You will then be shown, as I said, recommendations and considerations, and they're split into these two sections based on the language NICE uses in its cancer guidelines. You can see that even though we were searching in the chest system, other potential tumour types or pathways have been pulled through, and that's because I put in vague symptoms like fatigue and weight loss. And regardless of where you're searching in See the Signs, it will compare what you've inputted with the entirety of your cancer guidelines to make sure you're not missing something you may need to think about. Underneath each tumour type or pathway, you'll be shown whether to do a referral or a test or investigation, and next to that, a time frame. Now, we're all used to seeing a 2-week time frame next to our urgent cancer referrals, but you may not be used to seeing a time frame next to tests and investigations. But this is just reflective of what is in the NICE guidelines, and if you are doing these tests to exclude cancer, you should be following them up within a certain time frame that is often 2 weeks, but can be as little as 2 days. And then underneath this, you'll see whether you need to attach anything to your referral or what to do if a test or investigation comes back negative or positive. You will then have to choose whether to action, defer, or leave each option. The deferral option was added because of COVID, but can also be useful if patients are going on holiday, etc. Now, because I put in vague symptoms, there are different things that have come up here. You can see here that in the rapid diagnostic referral, it asks you to attach lots of tests like a fit test, FBC and chest x-ray that are already in the list here. So you may wish to do a combination of that referral and some tests, or just stick to some tests based on your assessment of the patient and what you think is most appropriate for them. Once you have decided what you are going to do, you then need to action, defer, or leave each option. So if you want to action something, you click in the action column. If you want to defer something, you click in the deferral column, or you leave it blank. If you do decide to defer something, if we scroll down to the bottom, it will ask you to select a reason for deferral, and that could be patient choice, self-isolating, COVID positive, etc. So we can continue to work through and decide whether we want to action, defer, or leave each option. Underneath the recommendation section is a resource section, and if there are any leaflets related to the recommendations above, they will get pulled into this section. You will see there's a leaflet here for the Rapid Diagnostic Centre, the original 2-week wait leaflet, the COVID 2-week wait leaflet, and a fit leaflet. If there is a language option, you will see a drop-down box and you can select another language here as well. You then have the option to text the leaflet to the patient or download and print it. This mobile number gets pulled through from EMIS, but you can always edit it if you wish. And then you can click on send. That will send through our system. The patient will receive a text message from See the Signs with a link to that leaflet and then the name of the doctor and the practice it was sent from. Or you can download and print it off like so. These resources will change if you switch hospitals. So let's say we wanted to see what happens in Kent hospitals. We would click on Kent here, and you can see some of the recommendations change, and that's because there's different referral criteria, and also you'll see the resources will change to what leaflets are available in that area. we go back to the London hospitals now, let's action and defer some of our options so that we can see how that moves to the next stage. Because I chose to action that 2-week wait, you can see I now have the option to proceed to referral form. If I had just chosen to action a test or investigation, then you would be able to proceed straight to the patient summary at this point. But we are going to go to the referral form so you can see how this works. The form will be pulled through and the patient details will be filled in. Notice on the left, you also have the option to text a leaflet at this point in case you have forgotten to do it on the previous page. As we scroll through, you can also see that the GP details are filled in, as well as the cancer type suspected out of the 3 options. And if we go to the lymphoma box, you can see the symptoms that we have originally inputted that flagged for you to think about doing this referral have been ticked off. But you can tick off other things if you wish. Any recent consultations, etc. get pulled through, but you can edit any of these boxes as you wish. We then come to the 4 boxes we always have to fill out. You can notice that the box about safety netting has already been pre-ticked, and that's because anyone who gets saved through See the Signs will also automatically save on our cancer safety netting system. If I'd have text the patient or printed off the leaflet, this box will get pre-ticked as well. This form is digital, so if there are any mandatory fields, it will not let you complete the form until you have filled out all those sections. So let's say I leave this mandatory field blank and I try and complete the form. It will alert me to the fact that there are still mandatory fields that are outstanding that need to be filled out, and highlight those in red for me. This ensures that you fill out your forms correctly and that they don't get bounced back from secondary care because there are mandatory fields that have been left blank. We'll then generate the form. It's important to note that we work with your local CCG to make sure that the forms, leaflets and pathways are kept up to date, so you can be assured when you're using See the Signs you are getting the most up-to-date information. You'll then be brought to our patient summary page, and regardless of whether you do a 2-week wait form or not, you will always be shown a summary before anything saves into the notes. If you have done a referral, you will see the 2-week wait form in a pink bar at the top with a tick. You can add another referral form here if you wish, although that's rarely needed. And underneath this, you can see a notice about ensuring that any referral forms completed through See the Signs are sent via ERS. Underneath this is a patient summary. And regardless of whether you do a 2-week wait form or not, as I mentioned, you will always be shown a summary. You'll be shown the presentation, the outcomes, what you've decided to action, defer and why, and if you gave a leaflet. You can edit this if you wish, and you can also close this page in the top left without saving at this point if you wish. But we're going to choose to save to the patient notes and the practice dashboard today. Once the summary has been saved into the notes, you'll see this success sign. You can then minimize the page and go back into Vision to see your consultation. You'll be able to see what you did on See the Signs, and anything that can be coded will be coded into the journal section of Vision. The 2-week wait form is attached here, but you will need to send that through ERS like you normally would. If you have chosen to do any tests or investigations like a fit test or chest x-ray, you will need to order that through the pathology system you use, such as ICE, TQuest or DART, like you normally would. Moving on to the next portion of See the Signs, which is the practice dashboard function. And this is our safety netting tool. Administrators can access the practice dashboard function of See the Signs to help keep an overview and assist you in safety netting patients who potentially have cancer in your surgery. There are 5 tabs on the dashboard: active, deferred, cancer confirmed, cancer excluded, and practice data. And for the first 3 tabs, you'll see a number in the top right correlating to the amount of patients that are found in that tab. If you save a patient through See the Signs following a risk assessment onto EMIS, they will also automatically save onto the active or the deferred dashboard, depending on whether you decided to action or defer their management plan. Here we can see our test patient, Mr. James Bond, who referred him, the date he was referred, and a waiting time. If you open up the notes, you can see more information about the presentation, the working diagnosis, and the plan. You can add notes here, so you could put in if all normal, book routine, follow up in 4 weeks with whichever doctor you want that to be with, so that everyone knows what the plan is for your patient. As I mentioned, administrators can log on and become users of this practice dashboard to keep an overview of this as well. And then as you get your results through, you can action these. So with your fit test, if it were to come back negative, you could put in result normal, or if it were to come back positive, you would need to do a lower GI referral, so you can select further action required and complete that lower GI referral using See the Signs. The pros of this is that the referral form will complete with all the information you've already inputted into the tool. You'll be able to text the patient the leaflet directly from that form, as you saw previously on that left-hand side. And also it will save onto the See the Signs safety netting dashboard, so that everyone in the practice can see the fit test came back positive, the lower GI referral has been done, and it's been safety netted. For any 2-week wait referrals, there's the additional option of ticking off attendance. This is because we know that clinical letters from secondary care are often delayed, and admin will call patients to make sure they've at least been to their appointment within 2 weeks. And you can tick that off here so that everyone knows they've been to their appointment, and we just need to be chasing up the clinical letter for this patient. Once you have that letter, you can select an outcome. If a cancer is diagnosed, you can input that. So let's say there was a lymphoma of an unknown stage, and we can save that. That will save and code into EMIS. As you can see, the record has been updated, as well as moving the patient to the Cancer Confirmed tab. Although notice the patient has yet to be removed from the active tab, and that's because there's still plans outstanding. And only once all the plans have been actioned will the patient get removed from the active board, and that's for safety reasons. If we minimize this page and go back to EMIS, you can see that cancer diagnosis that we inputted. There are a couple of additional buttons here. You can add a consultation. So let's say your patient comes back with new red flag symptoms, so you can skip the fit test and go straight to a lower GI referral. You can add that consultation and form here. You can also remove the patient if they move practices, pass away, etc. You can filter this page in a variety of different ways. You can use a quick filter button at the top of the page and filter by referrer, and that's useful for your own learning. By start and end date or waiting time, that's often used by admin if they want to chase 2-week wait referrals, for example. Or if you're searching for something specific, let's say a fit test, you could bring up everyone in the practice who's awaiting a fit test result. You can also use the column headings to filter this page. So you could bring up everyone who's been waiting the longest, all the investigations to the top, etc. Now, you may not need the risk assessment support when deciding on a management plan for a patient, but still want to add the patient to the See the Signs safety netting dashboard. There's 2 ways in which you can do this. Either you can add the patient using this button here if you've already done the form, or you're just doing a test or investigation. Alternatively, if you have the correct patient open, you can click on that first button, which was risk assess the patient, and complete the referral form using See the Signs. So let's use the example of a breast patient with a breast lump. We know in most cases we're going to send them on a breast 2-week wait. So we can skip the risk assessment portion, go straight to the referral form, Select the hospital form you want, click on breast here, fill out your form, text the patient the leaflet directly from the form, save it onto EMIS, and it will also automatically save onto the Active Practice dashboard as well. Just going back to that risk assessment homepage, I just wanted to highlight the resource button. So we host lots of leaflets, not just patient information leaflets for 2-week waits on the See the Signs risk assessment homepage. We have multiple charity partners. You can get assistance for your patients once they've been diagnosed with cancer about benefits, mental health support, etc. And you can text those leaflets directly to your patients as well. Going back to our practice dashboard, we've gone through the active page now and how you can keep everyone in your practice who is having not just a cancer referral, but a test or investigation to exclude cancer all in one place, and that is accessible not just for clinicians, but also for admin staff involved in cancer safety netting. Next is the deferred board. Anyone who has had an investigation or referral deferred will be found on this board. If we open up our test patient, Mr. James Bond here, you can see the chest x-ray that we decided to defer. And you can add notes here again, so you could put in complete self-isolation on X date or comes back from holiday on X date, so everyone in the practice knows when you can send off that referral or order that test. Once you have ordered the test or sent off the referral, you can outcome this. If it were a 2-week wait referral, you'd be able to also complete the referral form using See the Signs and save that. That will then move the patient from the deferred board to the active board. And if we go into Mr. James Bond's notes on the active board, you can see that chest x-ray is now in the active plan, so that everyone in the practice knows that investigation has been ordered and we need to be looking out for an outcome. Going back to the deferred board, again, you can filter this page and you can add patients using the button in the top left. You can also filter using these column headings. Next is the Cancer Confirm tab. And here you can see our patient, Mr. James Bond, and if we open up the notes, that lymphoma that we just inputted. There's a button here that allows you to conduct cancer care reviews, and you can save this in the notes and that will code. This is helpful because you can see a time since diagnosis. And if you were to add all your patients with cancer to this board, either by moving them through See the Signs or adding them using the button in the top left, you can easily filter this page by dates or using the column headings to find all your patients that are due a cancer care review. This will save you from having to run recodes, which often don't pull through all the patients that you are looking for. Once you have completed the cancer care review, this time since diagnosis will turn from green to grey, showing you that has been done. Next is the Cancer Excluded board. And if someone's results all come back normal, the patient will get removed from the active board into the Cancer Excluded board. And they will remain here for 15 months for safety reasons and also for audit purposes. Lastly, moving on to the Practice Data tab. And this brings me to the QoF QI module and PCN-DES for early cancer diagnosis. The targets for both overlap and focus on adherence to NICE NG12 cancer guidelines, standardising referral practices, giving patients information leaflets, safety netting not just 2-week waits, but all tests and investigations that are there to exclude cancer, and facilitating learning and reflection. And you can see how See the Signs can help you with all of those targets. At the top, you'll see your Public Health England fingertips data. At the moment, we have 18-19 data on here, but we are hoping to get 19-20 data released by them very soon. At the top, in the grey bar, you'll see your practice. Underneath this, your PCN network, your CCG average, and the England average. And you'll see the 4 main outcomes that Public Health England are looking at: detection rate, conversion rate, 2-week wait referral rate, and A&E presentation rate. If you want to remind yourself how these are calculated, just hover over the I button and we will show you. If you do want to know more about your PCN averages, You can click on the arrow on the right, open up this section and see the data from the other practices within your PCN, like so. If you want any tips about how to improve your practice's performance, you can open up this tab here. Moving on, we then have the See the Signs live data. And this is dependent on your practice's use of See the Signs. But if you were to use it to its full capabilities, you can get some really rich data out to help you with your cough and your PCN DES. You can see that you also have the option to switch between your practice and other practices in your PCN or see your PCN average. You can also pick which time frame you want to see the data within. You'll then see how many patients have been risk assessed, 2-week wait referrals sent, patients diagnosed with cancer, investigations requested, patients safety netted, given leaflets, and had cancer care reviews completed within 6 months. You can see who is registered to use it in your practice, and your most common cancer referrals and cancer investigations. If you hover over one of these pathways, you will also be able to see how many cancers were confirmed through that pathway. If you're looking for a referral or investigation that is not in these graphs, you can open up the tab at the bottom, scroll through, and find the investigation or referral you're looking for. Lastly, at the bottom, we have a reflections and actions section. This will allow you to document any meetings, reflections, or actions you have either as a surgery or as a PCN regarding your cancer performance and early cancer diagnosis. That will then be saved, and people in your practice and PCN will then be able to see that documentation to enable you to work towards your goals together. So thank you for watching our webinar training session on See the Signs. If you would like any further information or have any questions, please contact us at training@seethesigns.co.uk. Thank you.